Good morning everyone. My name is Niveta Raja and this topic is going to be about femur bone. So femur is the longest and strongest bone of the body. It consists of three parts: upper end, shaft and lower end. Upper end consists of head which articulates with acetabulum of the hip joint. So it contains a pit called as fovea capitis which is placed behind the center of the head. Teres ligament is attached to the fovea capitis. The second part of the upper end is called as neck. It connects the head with shaft. It is about 5 cm in length. It is an intracapsular region. So neck has an angle, so it is termed as neck shaft angle. It is an angle between lower border of neck and medial border of the shaft. It is about 125 degree. So the medial part of neck is intracapsular. Greater trochanter. There is a large prominence at the upper part of junction of the neck with shaft, which is termed as greater trochanter. A ridge on the upper part of the medial surface receives the insertion of these three muscles named as inferior gemellus, superior gemellus and obturator internus. So these muscles generally arises from the ischium part and gets inserted into the ridge of femur. Next, trochanter fossa. The depression in the lower part of the greater trochanter is termed as trochanter fossa. So it receives an insertion of obturator externus. Anterior surface. This surface of the greater trochanter receives insertion of gluteus minimus muscle. The anterior surface receives insertion of gluteus minimus muscle and lateral surface receives insertion of gluteus medial muscles and the apex surface receives insertions of piriformis muscle. This is about lesser trochanter. So lesser trochanter is placed behind or placed posteriorly. It receives insertion from the iliopsoas muscle. Intertrochanteric crust. It connects the greater and lesser trochanter posteriorly. Quadrate tubercle is an elevation in this crest and receives the insertion of quadrate femoris muscle. This is an intertrochanteric line. It connects greater and lesser trochanter in the anterior position. The capsule of hip joint is attached to this line. The next part is going to be the shaft of femur. The posterior surface of shaft presents a bony ridge called linea aspera with medial and lateral lips. So this is the posterior part of the femur which shows a ridge named as linea aspera. Linea aspera in the medial upper border is termed as pectineal line and lateral upper border is termed as gluteal tuberosity. The linea aspera in the downwards aspect medially termed as medial supracondylar line and laterally termed as lateral supracondylar line. Next is going to be the lower end. The lower end of femur has two condyles. Okay, so medial and lateral condyle. Posteriorly, two condyles are separated by a gap or by a opening or a fossa called as intercondylar fossa. It has two surfaces in it, patella surface and tibial surface. The patella surface articulates with the patella anteriorly. The tibial surface articulates with the tibia inferiorly. So this bone shows that patella is present in the anterior position while tibia is present in the inferior position in the aspect of anterior part of femur. So moving on to applied anatomy, the common site of fracture is in the neck in old age. Coxa is a condition in which the neck shaft angle is being reduced. The fracture of neck may damage the blood vessels supplying the neck and head. It may lead to necrosis of head. Medico-legal importance is that the epiphyseal center for the lower end of femur appears just before birth in 9th month of intrauterine life. Hence, its presence provides a proof for viability of the baby. In case of supracondylar fracture, the distal segment is pulled backwards by gastrocnemius muscle, which may injure the popliteal artery. Thank you.